In our final example, we will look at the 10-year risk of heart disease for patients 20 years or older who don't already have heart disease. This is the ASCVD Risk Estimator Plus. We will once again compute the ASCVD score for a patient by hand. Here we have a 55-year-old African American woman with the following features. There are a couple of new features in this model. First, notice that in addition to taking the natural log of some of the features, we have features which are the product of two things, like the natural log of age multiplied by the natural log of HDLC. These are called interaction terms, and we will dive deeper into why these are useful, but for now all that's necessary to understand is that for interaction terms, we're going to multiply two values. In this case, we will take the natural log of 55 and multiply that by the natural log of 50. The second thing to notice here is that we have a negative coefficient associated with some of the features. For example, we have a negative coefficient associated with the natural log of HDLC. Here, a negative coefficient means that the contribution of this feature is negative, which means that it's lowering the score. Now, this makes sense because HDLC is high-density cholesterol, and that's often called good cholesterol, and thus we might expect would lower the risk of heart disease. We can similarly compute the risk score as in the previous examples, where we fill in the values using the information we have, and then multiply each of the values by the coefficient and sum of this column to arrive at a sum. In practice, this sum is converted to a risk score using this formula. Don't worry too much about where this formula is coming from. All that's important to understand is that we can plug the sum into this formula right here to arrive at a 10-year probability of getting heart disease. For this patient, that comes out to 3%.